As we shed light on the accomplishments of women this month, it's also important to address some of the challenges we face. Each year, cardiovascular disease is responsible for 1 in 3 deaths of women. With more than half of black women in this country living with hypertension, the condition is much more urgent for the African American community. Helping to raise awareness is Joni Rials. She is one of several women in Chicago being honored by the American Heart Association. Welcome and thank you for that, and congratulations. And you're also, for the last 20 years, been a registered nurse.
This is true, yes.
And you work with cardiac patients.
I do.
Is it surprising to you that women, especially, don't know that it's the biggest killer of women over breast cancer, heart disease?
It's not surprising. It's really, everyone thinks it's cancer. So because cancer is this big, scary disease. And so cardiovascular disease tends to be a little bit more quiet. It kind of creeps up on you a little bit more.
Literally.
So I think that's why.
So what should we be looking out for as women on a daily?
Things like constant high headaches, constant anxiety attacks, shortness of breath, sweating. The problem is that
and we're not talking about menopause. We're talking about cardiac, because all that goes with menopause too.
So, and that's one of the issues as well, is because menopause is kind of gaining momentum, is being studied as well. But menopause has so many effects with cardiovascular disease.
Really?
Yeah. So a lot of things, when you hit like 35, we're starting to see women come into perimenopause a lot earlier now.
Why is that, you think?
I don't know. It's not. So this is why.
Yeah, this is why you're talking. And we're trying to get the word out.
Yes, we need the money for more research. You know, women weren't clinically included in clinical trials until the 70s. So we're way behind the 8 ball in terms of research. So a lot of the research that's going on nowadays is based on research that were geared for men and not necessarily tailored for women. So that's one of the big pushes for the Go Red for Women campaign.
So disheartening, no pun intended, that they were so behind the 8 ball with women's research. Like, we didn't matter. Like, who cares? But we're the ones who run the family. We're the ones who handle most of the stress and things like that. And what was it that ding, 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 ding made them realize we should start researching women?
So in 2004, there was a group of women that were connected with the American Heart Association, and they determined that, listen, we see women, they're coming in, they're having heart attacks, they're not being really treated as aggressively as men, so we need to create this awareness. So that's what the Go Red for Women campaign is all about. Now, prior to that, there were some things that happened in the science community in the early 1900s, the mid 1900s, related to research that banned, the federal government decided to ban women of childbearing years from research. So in the 70s, that got turned around, and so there became a law that then said, hey, we have to include women and children into this research.
So many inequities. And how are black women more susceptible to this?
Oh, wow. So socioeconomic issues, we're starting to see more and more now. There may be some genetic factors that play into this as well, but more so it's awareness. Because like you said earlier, we're the butcher, the baker, the candlestick maker, we take care of everyone, our churches, our community, our family, that we put ourselves last so many times. And so these are all reasons why the disparities in healthcare, the inequities in healthcare, because the funding is not there to research and to adequately fund awareness campaigns, that these are all reasons why black women kind of are suffering at higher rates as well.
Everything just falls into line, you know, everything just ends up being the same. Okay, so if you're at home right now, what should you be looking for if you're not feeling well? I know you said sweating and things like that, but what in particular, because the signs are different than for men, right?
So we share some of the similar signs. The problem is that there's some other silent signs that come along. So I'll give you an example, Micah. Let's say you're not feeling well, you're at home, and you say, you know, I'm just gonna get up and go to the hospital. You get to the ED, and then you're talking to the physician, and you're saying, you know, my back has been hurting lately. I have nausea. I may have vomited a couple times, but just an intense nausea I've been so tired. Well, who isn't tired? We're all doing a lot nowadays, right? So instead of saying, I have chest pain, I have numbness in my left or my right arm, we tend to have these other symptoms as well as chest pain, because we do have that in common. So then sometimes the thinking goes, it's an anxiety attack.
Right.
It's an asthma attack. So we'll treat you for anxiety. We won't work you up for cardiac arrest or, heart attack.
Is that because of money that they're not going to do that? They're going to like tell you go back home and take this medicine instead of doing the whole workup?
You know, unfortunately, it starts in medical school. It starts in nursing school. That a lot of the education now isn't geared toward looking at a woman and saying, hey, nausea, vomiting, anxiety, sense of dread, extreme fatigue. Let's give them a cardiac workup instead of just
in case
following up.
Yeah,
absolutely.
And so you've got to empower yourself. You have to be your own advocate, don't you?
You do.
Yeah.
You do. And that's part of the work that I do in the community and with the Go Red for Women campaign. It's just giving women the audacity, if you will, to say, hey, I know you think this is this. I need a 12 lead. So I always tell women, if you go somewhere, if you're in your provider's office or you're in the emergency room and you have these symptoms and you know your body, you know something's not right.
And you do know your body.
For a 12 lead.
Now, what's a 12 lead?
So a 12 lead is an electrocardiogram. It takes this electrical picture of your heart and it studies the way that your heart's beating and it's looking for the rhythm. So now if you're having a heart attack, there may be an abnormal rhythm that we can see that'll say, ooh, yeah, let's get her over to the cath lab so we can open up that artery and see what's going on in there.
So ask for a 12 lead, folks. Yes. 12 lead, because as we said, we do know our bodies. We ignore this stuff sometimes, but we do feel, okay, I'm feeling a little off today. We may say a little off, but that really makes a difference.
It does.
You know? Is nutrition like one of the main things you should be looking at, or is it just a part of it? Is it a small part of it?
No, it's a big part of it. So the American Heart Association has the Essential 8, correct? So these are like 8 pillars or 8 guidelines that you can use to implement into your life. So number 1, smoking and vaping. You got to get rid of it. You have to stop it. 150 minutes of cardiovascular activity or some type of movement every week.
Okay, 150 minutes of it every week? Okay.
So it's like 30 minutes, 5 days or so. Take a couple of days off for a break. Walking your dog, yoga, Pilates, nutrition, yes. The Mediterranean diet has been scientifically proven as a superior diet.
Yeah, they talk about that, so that's really good for you.
Yeah, it is.
All right. Okay, so we've got the 8 pillars. We've got ask for a 12 lead. I'm going to remember that. Ask for the 12 lead. Good nutrition. Just take care of yourself and be aware of your body.
Yes.
Be in tune with your own body.
Absolutely.
I love it. Congratulations to you, by the way.
Thank you.
You can find more on the American Heart Association's fight for women's heart health at goredforwomen.org. By the way, I love that T-shirt.
Thank you.